We're going to start with our first panelist, Marcia Griffiths. Marcia is the president of the Manoff Group, a company that specializes in nutrition programs and social marketing. Marcia is known for her field work, her technical expertise, and innovative programming in applied nutrition and social marketing. Today, she's going to discuss how to use formative research effectively. Marcia. Sorry.
Thank you, Denise. That was really nice. And thanks to IYCN. And this is such a tremendous opportunity to be here. There's so many people here, and to see all the country folks, it's really great. So thank you. As Denise said, I'm going to talk a little bit about formative research. It's part of the role that we've played on IYCN, although certainly not in every country. But I do want to give a little bit of caveat. I've tried to be a tiny bit provocative to get some discussion about formative research going. What I'm going to say, you also heard from some country folks, does not necessarily apply to the work of IYCN, but it certainly applies to a lot of the work that I'm seeing in my travels, as I work with projects. So the title of my talk is Remedial Action Needed. You can see it up there. Because I think we're really moved away from something that was at the core of successful nutrition programs earlier. Okay, and I'm going to start with where I think a lot of us are starting today with the SUN, the Scaling Up Nutrition movement that is really, offering us a new window in our programs. And one of the principles of SUN is to develop strong, and I want to emphasize prioritized country strategies. And certainly when they developed that, they were thinking about the epidemiology and being sure that every country was looking at their nutrition epidemiology, the pathways to improve nutrition, and programming around those sorts of profiles. But I contend that there is another way that we should be prioritizing, and that is by behaviors. And we need to be building behavioral profiles. So just as we prioritize about epidemiology, we should be prioritizing about behaviors. And not all countries have the same behavioral profile. How are we going to establish that behavioral profile? We're going to establish it through formative research. Or as some of the IYCN country people were talking about, formative assessments. Whatever term you want to use, I don't care, but it's this formative. It's before your project is developed. It helps you form the project. And if we go way back, and some of us with some gray hair remember those days, and we look at successful nutrition programs from the 80s, a big key lesson that emerged from those programs was the importance of formative research. And that formative research, that is the voice of the consumer, the voice of the caregiver, whatever you want, drove the development of those programs. So that was a best practice to come out of those successful programs. Thailand, Indonesia, the early vitamin A work about green leafy vegetables, the work about diarrhea and child feeding. All those spent a lot of time developing tools for formative research. I do want to emphasize that formative research is generally qualitative. Ethnographic style research, you're understanding the context. It is not your baseline survey. It is helping you understand the meaning behind the numbers. So when you get your DHS surveys or your mix or whatever quantitative surveys, your formative research is helping you understand why those numbers are there. And then your baseline, your new insights feed into your baseline. So formative and baseline kind of go together, but formative research is not baseline research. And finally, on this slide, I want to just emphasize that nutrition used to be pioneering, frankly, among a lot of public health areas in the formative research. And one of the things that was developed in the 80s was formative research, not just to understand determinants of current behavior, but to understand determinants of new behaviors. And you heard Janet talk a little bit about the tips in Malawi. So they looked at what was going on in their formative research, but then they actually allowed a small sample of mothers to try things so they could understand what was really preventing practice of new behaviors, so the determinants of new behaviors. And they're often a little different. What determines what people are doing now and what determines what people might do. So the challenge all along in formative research is building that bridge. Building that bridge from what people are doing to the program. Sometimes that bridge is real high and real skinny and shakes a lot. Other times the bridge is really solid. And of course, in commercial work, that bridge is super solid, and the formative research and the design of programs to market products are almost one and the same. But you know, our bridge is up there teetering. But what sort of happened, you know, that was the picture of building that bridge in the 80s. And then it's my appreciation, and hopefully some people are going to disagree with me, that we started moving away from that bridge building. And for I think a couple of reasons. One, people got very into, you know, what methodology and how can we do this quicker, and how can we do this for less cost, and do we really need to do formative research, and we think we know the answers because the scientists have been out there with double-blind randomized trials, et cetera. And so I think, you know, some people were kind of, you know, crossing down there over the water, but they weren't really building the bridges. And this is where I think we are today. I mean, I really think that the programs that are not the Grand Canyon are the exceptions. I think we have a huge Grand Canyon out there. Yes, and for those of you who've never visited the Grand Canyon, it's a beautiful place. And, there are few bridges, and we really, I think, for a variety of reasons, have moved away from bringing the voice of the consumer really into program design. And one of the reasons, I think, let's see if I'm stirring some controversy, is because we have all these global guidelines. Got global guidelines, essential nutrition actions, you know, here it is, let's put it on the table and move. And so those bridges are deteriorating. What do I think people should look for? I mean, you know, in looking through materials and looking at programs, how do you know whether there's been formative research? How do you know that the voice of the consumer has come into materials and program planning? Well, like a really obvious thing is, are local foods mentioned? Are local terms mentioned? I looked through some of these things, there's not one local word or term. Then, what about our local beliefs addressed? A lot of places have huge seasonality issues that should be addressed. Or family patterns. We talked a lot about grandmothers and fathers, which IYCN is addressing. But a lot of these other materials don't, and the programs are completely devoid of those important issues. And then, making behavioral priorities. All of those behaviors in the guidelines are not all important everywhere. I mean, you might need to mention them, but you need to pick out priorities, and I'm going to talk a little bit more about that. And then the recommendations need to be very specific and action-oriented. And you know, they are really not things like, you know, feed your child an animal source food. You know, that's not very action oriented. And then the motivations need to be caregiver focused, not health professional focused. So I'm gonna go hopefully quickly through what I mean by making behavioral priorities and a little bit about actionable messages. And I wanna just take, so if we say, you guys all know this, I mean, if these are the global guidelines for how to feed a child from 9 months to a year old, and I'm not, you know, let's not quibble about these, but if these are the global guidelines, does every country need all of these? And how do these differ, and how do we pick out priorities? So let me take you into Rianne's home. And I'm gonna really, these are outcomes of formative research and what we learned. And I'm gonna highlight some kids, but they're really representative of their whole communities, their whole areas. So here's Rianne, she's 9 months old. And when we looked at her feeding, she's getting breastfed. I'm gonna just refer to my notes quickly so I can remember these cases. So she is getting breastfed. She is being fed 3 or 4 times a day, but, and a fairly appropriate amount, but what is she getting? She is getting a bulgur made from rice flour. Not even rice flour. So this thing just puffs up like crazy. So she's eating 2/3 of a cup of food or a half a cup of food, whatever you want. There's nothing there. There's rice flour there. So, you know, what is the priority in this case? And occasionally it gets a little tahu, a few green leafy vegetables. But the huge issue here is density and variety. Not so much frequency, and the breastfeeding is reasonable. So the priority here is density. Let's go on to Katrina. She's in Kazakhstan, and she's 10 months old. Now she's breastfed 3 times a day. She gets tea, sweet tea, multiple times a day. She's being fed family food once a day, and bread and biscuits constantly, 8 or 9 times a day. She gets a little biscuit. So in this case, she's not getting a gruel. Density's not really an issue. Her issue is, you know, breastfeeding should be reinforced and that tea drinking stopped. And she's like kind of getting food almost too many times a day. So the issue is, for her, the family food and actually getting a meal and dealing with the biscuits and the snacking. So that's very different from the Indonesia picture. Here's Robert in Swaziland. So Robert in Swaziland is 11 months old. He's being breastfed on demand. Good breastfeeding frequency, and in fact the mom is sitting down and the breastfeeding is good. He's getting a corn grit, like porridge with sour milk, 3 times a day. But the issue is the corn grit, the mom's cooking it like once a day, and it's kind of sitting out uncovered, and it's, whoa, and it's really very, very bad, and Robert has diarrhea a lot. So, you know, the emphasis here really needs to be on sanitation, again, on diversity and mixing of family food. And, you know, really quickly, this is Esmeralda, and her issue, really good, frankly, pretty good feeding, but her issue is that her mom's only giving her a tiny bit. I mean, literally like 2 teaspoons of food, afraid that it's not like it's gonna be heavy on her stomach. So the issue here is really volume, and she's holding a little child feeding bowl that got introduced to help the mom with amount of food. So I just want to make the point when I'm talking about behavioral priorities And the translation of what you learn in the formative research, it's not just to sit there on the table and make a nice report, needs to be brought forward. So all these kids have problems with variety. But the thing to really concentrate on for the 9 to 11 months varied country by country. Very different situations. Really quickly, an example of how even one issue like food diversity needs to vary. And here I want to talk really quickly about some research in Malawi done. This is Janet's research and a Rwanda situation focusing on increasing food diversity. To increase food diversity, basically people have to feed their children more. And then, as you know, because everybody's got these carbohydrate rules, there's a whole lot of different foods that people need to feed. So in this TIPS research, what we learned is that people could in fact increase diversity, but they couldn't really do it every day. So this idea that everybody's going to do everything every day. Illness played a tremendous role, which we often really forget about. And addressing mothers' concerns was absolutely critical. So if we're going to talk about amount, moms are concerned about wasting food. And that really needed to be addressed in terms of improving diversity. This reliance on forage, moms are concerned about whether things are easy to digest. And so that needs to be addressed. Purchasing snacks. Moms, convenience, and moms want to do what children want. So again, we need to address these caregiver concerns that are keeping them from in fact trying new things and improving diversity. And then, as Janet alluded to, there was a lot of sweet tea and sodas and snack foods found. And so the idea of substituting, women were willing to substitute, and there the issue was really saving money. I didn't put that down here. So again, bringing forward, addressing women's concerns, bringing forward things means that the recommendations are going to be very specific, not just animal source foods, or not just fruits and vegetables, or not just here are the food groups, pick something from the food groups, but they're going to be specific by age. Women need help to figure out, what are you doing today? What are you going to do tomorrow? Some focus foods. So for example, dried fish is almost like a miracle food. In Malawi, groundnut paste. So mentioning, as you look at materials, are there very specific foods that we've learned from the formative research that get moved forward into the programs? And motivations. I just want to say that it's very interesting. We love to say how your child's going to be more healthy, less frequent illness, and I'm not saying that isn't important. But when moms talked about the benefits of all of these practices, they focused on child behavior. My child's less fussy, my child's going to sleep better, my child's going to play more, my child's going to be willing to, sit with the grandmother, etc. Moms are already overworked, but they're looking for more time to do their work and just, to have a minute to themselves. So those are really the motivations that come from the mothers, and we need to carry those over into our materials. And this is, I'm not going to focus on these numbers. Again, this is from Malawi, and it really shows the shift that one can expect. But the point here is, if we know precisely what behavior we're after and why, those very specific behaviors, like reducing, I don't know how to say it, but the Magawi porridge, that's the really runny corn flour porridge. I mean, if we're really after reducing that, then if we know that, we can track it. So my last thing is just a plea about building the bridge. Let's go back to building the bridge. You all are program people, program designers, developers, and implementers. When you have your formative research, don't just talk about it. really, really look and demand that insights from that research build the pieces of this bridge and bring the voice of the consumer forward into program planning. Start with the global guidelines, but they really, really need to have that bridge, consumer to global guidelines. So,